Anthony Storey, project manager with CRL Contracting. Today we're at a new job in Suwanee, Georgia. It's called Peachtree Pediatric Urgent Care. It'll be open late hours and on the weekends. It's about a 3,000 square foot build out. So let's step inside and take a look. Alright, now we're inside the waiting room. To my right is the check-in area. Quite a good size waiting area up front. Again, this is urgent care for pediatrics. They will be open at nights and on the weekends for once the doctor's offices are closed for minor things outside of needing to take somebody to the ER. So now we'll move back into the extra areas by the exam rooms. All right, I'm standing at the back side of the reception area now. There'll be an area for two people to do check-in, get patients ready. Then they'll come over into triage. There's two triage areas. We've got two hallways that come into the suite. And on my right side are the exam rooms. There's 3 exam rooms on this side, and then we'll walk past 3 exam rooms on the other side. Also down here on my left is one of the restrooms, and now we'll move down to the X-ray room. Now we're in the X-ray room. X-ray table will be sitting along this way, and equipment set up there. And over here to my right will be the booth where the technician stays. There will be a lead glass window here for the technician's protection. And over on my left, you'll see some of the lead-lined sheetrock that will be going on the walls. The lead wraps the entire room of where the X-rays will actually be traveling at to protect anyone outside that doesn't need to be affected by the X-ray. And so now we'll move over to the doctor's workstation. This area will be a doctor's workstation where he'll come between seeing patients. To my left is the lab area. It's kind of basic right now, just boxed out. On our later videos, we'll get in there and show all the mill work that goes in. But there will be 2 workstations here for the doctor to come back and do chart updates in between seeing patients. Now we'll move over to our other hallway, showing the last couple of exam rooms and a few other things on our way out. What you see now is the break room. It's a nice sized break room. They'll have plenty of room to move around, get some relaxation time around lunch. And then down this way is the hallway that goes over to the rest of our exam rooms. There's 3 more exam rooms down this hallway. Also a utility closet over on my left, and 1 more restroom. There's a total of 6 exam rooms in this build out. The overall build out is 2,715 square feet. We'll make 1 more trip down here to the doctor's office, and then we'll exit the building. Now we're in the doctor's office. He'll have his own entrance off the sidewalk coming in, and over on my right is a large window where he'll be able to oversee the waiting room, see what patient load is out there, and have an idea of what he's looking at for the day. Also, as we were going through, I didn't point out we were at a 50% margin with the build out at the time. Electrical is at their 50%, plumbing's at their 50%, same thing with HVAC. We're ready to call for those inspections, and then we'll start doubling up the sheetrock and sealing all the walls in. Thanks for coming out. We'll get you back in here when we're at 80% and start seeing some of the closed up walls and some of the millwork.